She said, your white blood count is high again. I'm referring your case to a hematologist oncologist. And it just floored me. My oncologist said, you probably have had this for a while, see if you can pull some records. And I contacted my doctor's office and they faxed the information to me, and I'm like, wow, he's right. There it is. And so I had been living with it for at least 3 years. And I suspect a couple of years before that. Yeah, I like doing puzzles.
The last piece of my 2,000-piece puzzle! Yay!
I like animals, especially cats. I'm married. I live in California, retired about 7 years now. And I love to travel, although that has been curtailed.
Hi, Sis. Thanks for coming to Happy Days and celebrating my birthday.
So I've done a few short things. I love my lunch dates with my girlfriends, and that's me.
Let's rewind, Leesa, all the way back to, 2008. And I know it goes back further. We'll start at 2008. You didn't really have first symptoms necessarily. You switched insurance, you went somewhere else, and that's when things started to happen. Can you tell us how things started to get flagged?
Well, I switched insurance, like you said, and I decided, well, I'll have a physical since with this insurance that's covered. And when my results came back, my doctor said, your white blood count is high. Have you been feeling sick? I said, no, I feel great. She said, well, then retest in a few weeks. And I tested again. She said, your white blood count is high again. I'm referring your case to a hematologist oncologist. And it just floored me. And my husband thought that, well, that just must be a mistake. You're healthy. That can't be true. And more blood tests were done, an appointment with a hematologist oncologist, and tests confirmed that it was indeed CLL.
Leesa, first, when the primary care said hematologist oncologist, that was the first, obviously, red flag, right? What was how did you process that?
Mostly just shock. And it felt like it was just surreal. And this can't really be happening. And I'm going to die. Those thoughts come in your head, I'm going to die.
Because that's what we think when we hear oncology or cancer. Yeah. And so you go to this specialist. First of all, it was within the Kaiser system, right? And so
he's a hematologist oncologist, not a CLL specialist. And I'm very fortunate in that he's extremely knowledgeable about CLL.
Leesa, you go to the oncologist, the hematologist oncologist. How does he describe the tests you're going to go through and what he's thinking?
Well, first off, various types of blood tests. We'll add all these others on. And the other test I had some months later, as I remember, was a bone marrow biopsy, which he was trying to do in his office, and I could not tolerate the pain. So that was put off for a time when I could be in a hospital setting and they could give me some sedation. And so those were the main tests that I had to get the diagnosis.
You mentioned a fish test, right? To actually get the more details.
And that was trisomy 12, or I don't say that right, trisomy 12, unmutated, which my oncologist said was a moderate progression. It's not the slowest growing CLL and it's not the fastest growing. So that diagnosis is kind of in the middle.
Did he, and then so when he said, "Oh, you have CLL," first of all, you're like, "What? What do I have?" How did he describe, and then, describe it, what your sort of path would be? A lot of times we're thinking, oh, we think of the acute cancer situation, right? We're not thinking chronic. At what point did you learn what this would mean for you?
Well, he told me right away that you'll be on a watch and wait with, having your blood test about every 3 months and visits with him the same. I think he kind of erred on the side of caution and always has seen me more frequently, even that I think some specialists see their patients. So that was our course of action. And I should let you know that I had heard of CLL because my aunt, my father's sister, she had CLL. And my dad's mother, my grandmother, I believe also had CLL. All we knew was she had leukemia, but she lived to be 94 and she was diagnosed in late in age. So I had heard of CLL because of my aunt. And she described it. She came from Texas to visit. She described it as, it's not the kind of cancer that's gonna kill you.
I love that you had this, like, first of all, great impression. I don't know, that was wonderful. So when you got diagnosed, you had someone in your life you could talk to about this. That's amazing, because I think that's the first time I've heard that someone actually knew someone personally with CLL after getting diagnosed with it. How was that? What was that like?
I think she had actually passed before I was diagnosed. So I couldn't really give her a call and ask about her experience, but her experience would have been different because the only drug they had to treat it in 2008 when I was diagnosed was chemo. And that's right when the BTK inhibitors and other drugs were coming out. So she had told me that she was not going to do chemo. And that was her only option at the time. Now we also know that people who are unmutated like me, that chemo doesn't work for them very long. It has a very short duration. So I'm really grateful that all these new drugs are available for me.
I appreciate you sharing that, Leesa. So how did you process? I mean, you had a point of reference, your aunt, but how did you process the diagnosis just in general, mentally, emotionally, and how did you break the news to the people in your life?
Well, I told my husband, and he was just as shocked as me. He cried, and I did not tell my father, who was in his late 80s and had mild dementia, but I knew that he did not process bad information well. So I chose not to talk to him about it, which is very difficult because, you want to be able to share with I didn't have my mother anymore, and I really wanted to share with him, but I knew that for me and for him, that was the best thing to do. So I told my, good friends, and it's difficult for people to understand this type of cancer and the whole watch and wait thing. But my friends were extremely supportive. I'll just say that for the first 6 or 8 months, I really felt like I was just in a complete fog, just going through the motions of life. And I'm usually a pretty positive person. But it just knocked me over, and it took me a really long time to wrap my head around it. And, now it's just part of my life 14 years later. I never thought I would ever say that I've had CLL 14 years when I was first diagnosed. When I was first diagnosed, I thought I only had a few more years to live.
Just the feeling of what you just said, thinking you only had a few years, how did you move through what, maybe in terms of guidance to other people, maybe people who are just now getting diagnosed with a chronic cancer like CLL, how you were able to best process how to live life differently, or what life meant for you now, or.
Okay, yeah. A lot of ways it was a blessing, because it taught me, do not put these fun things off. Do it all now. There was a trip my best friend asked me to go on with her sister and a friend to the beach, a very expensive place on the beach with massages included and expensive dinners. And normally I had just bought a new house with my new husband. I'd be like, oh, well, that's just an extravagant, expensive weekend. I can't do that. Well, the diagnosis made me say, I'm going. I can do it. It's not really that big of a deal. And so there was a lot of moments like that, but that one really stands out in my mind. And you just have to put it behind you and enjoy all the days. And it just something that switches within your own brain.
So do you have any guidance for people too in terms of how to help communicate what this is to other people and how to get support? Like, what support is so important?
Yeah, I think you find out pretty early on who's able to kind of understand it and be supportive to you and who's not. And, sadly, it doesn't mean they're a bad person or anything. They might want to try to sell you this product that they sell, and, this is amazing and it's going to get rid of your cancer. Or they might say you should go on this kind of diet or that kind of thing. Or the people who just don't understand and say, well, my aunt had it and she lived to be 90, or that kind of thing. So you find your people, and they might surprise you who they are and who they aren't. And you just need a couple of supportive people in your life, even one supportive friend or family member. And you go to them.
And let them know too ahead of time, this is something I'm going to be living with. This is not like a one and done type of a thing. And so setting it up, that expectation, right?
Right. It's not like you jump into having chemo immediately, that you do the polar opposite of that. We'll be watching and worrying, as some people call it.
Gosh, you learned something actually that I think would send anyone over onto the floor, which is you when you got diagnosed, you personally then ended up pulling your own records from before. And just to summarize, 3 years earlier, you had this unrelated surgery and you did have constant labs done then. What did you discover?
My oncologist said, you probably have had this for a while. See if you can pull some records. And I contacted my doctor's office, and they faxed the information to me. And I'm like, wow, he's right. There it is. And so I had been living with it for at least 3 years. And I suspect a couple of years before that, based on just a couple little minor changes, I started bruising very easily in my early 40s. When my husband first met me, he said, "You're like a banana." Because I always had maybe about 20 bruises on my legs at any given time. And I had to hold my shopping bags out to the side because if they touched my leg, I would bruise.
In that moment, did it cross your mind that that was incredibly abnormal for you? Or did you just feel like, oh, in retrospect?
In retrospect, I should have, but I was just like, that's just me. I've been like this for a while, but it's definitely a sign.
Now, in this case, thankfully, maybe you were put on watch and wait anyway. So it wasn't like, you got to a point where it, would have made a difference on your treatment. But I guess that's not the case for everybody. And it's just interesting to think you were in a hospital, you had healthcare professionals who are looking at these numbers for you or not. How does that make you feel?
Well, when I racked my brain thinking back to that time after I got my records, I had this vague memory of the nurse before my surgery who saw my labs asking me if I had been sick, because that's a common sign when your white blood count is high. You're sick or have an infection. And I said no. And she said, when your surgery is all said and done and you're feeling better, you should actually have that checked out or redo your labs. I totally forgot it, having gone through surgery and recovery for 6 weeks. And so my doctor that I really liked, I wonder why he didn't point it out to me and remind me, because I continued to see him. That should have been a red flag for him to bring that up 6 months later when I saw him, or, even while I saw him during recovery.
So the whole concept of watch and wait is something that I know you're very familiar with. I've learned about it, but I think most people have no idea what that really means. Like, what do you mean watch and wait? What do you mean I have cancer and you're not going to treat it right away? What does that mean? Can you talk about when the doctor said that to you, when the hematologist said that to you? What was your first reaction, and what questions did you ask or do you wish you would have asked?
My first reaction is different than a lot of people. A lot of people want it fixed right now, but not me. I'm like, oh, thank God I don't have to do chemo right now. Watch and wait, I can do that. I can do that. That's how I felt about it. So I just, saw him about every 3 months, had my labs done, had a CT scan to get a baseline on swelling of my lymph nodes and other organs that might be affected. And that's fine with me. I want to be on watch and wait for the rest of my life. I never want treatment. That was my thought. Treatment was horrible. That was my thought, but it's really not.
Knowing what you know now, I guess, what's your guidance to people on how to best deal with a period of surveillance or observation where you're not doing anything?
But just try to relax, enjoy it, learn what you can about CLL from reliable sources. Support groups are fantastic. It can be scary too in a support group, hearing other people's stories. I sometimes even felt some guilt because people were so sick, and here I was working full time, taking care of my elderly dad's needs, having fun, living a completely normal life. Granted, when I look back, especially as it neared my 10-year mark when I did need treatment, I was really so sick. And when I finally started treatment, I realized how many times I had felt so horrible and how much better I felt once I did start treatment. I had gotten used to feeling bad, used to having these flu-like symptoms. with no clue why, and just kind of still carrying on with life the best I could, working, doing everything around the house, living normally within those bounds. But once I started treatment, of course, there are side effects, and I had them, but I felt so much better. And I realized I didn't know I felt so bad until I started feeling better.
And going through these years, I marked from, generally speaking, November 2015 through December of 2017. You described, if I'm going to laundry list some of these: dizziness, headaches, nausea, pain on the head, tooth pain that was an infected tooth, pneumonia more than once, bronchitis, sinus infection, pain throughout your body, including muscle pain, some arthritis. Then at the end of it, vertigo and near blindness in your left eye.
I don't know how I did it. And I don't know how I did it, but you just do. So, you realize how strong you are when you don't think you are. And I hope to not have to do that again. It was difficult. My whole week was consumed with doctor appointments. And I remember I was retired before my husband, and he would say, "What do you do all day? Don't you get bored? Do you get bored?" I'm like, "Oh, never." But, it was a busy time with appointments and sickness.
I mean, it sounds like it was it really was like a full-time job to have to just handle everything, because it's not like you get to just lie around. You're having to go and make all these appointments and do follow-ups. And so that's a great expectation. Of course, everyone has a different, experience, but that is at least one example of, hey, expectation setting. There might be a lot of things you've got to do, even in the watch and wait period, right?
Right. Especially at the end, I would say those last couple of years. And my oncologist had mentioned several times, I think it's about time starting treatment. And I was kind of digging my heels in, and I was supposed to start in the fall. And I said, I want to wait until after Christmas. And I kind of wish I didn't, because that's when my whole eye thing started.
Let's talk about that. First, high level, your watch and wait started in 2009, and the years where you said it was more manageable was the first 5 years, I think. Then the last couple of years, 2015 and 2017, is when you really started to have to deal with all these regular appointments with different specialists. And at the end of it, like you're talking about, there's this ocular disease that can be caused by CLL, so a lot of eye problems. What did that look like for you? What was going on?
It was after Christmas. It was actually December 28th. I was in a restaurant waiting for my friend to have lunch. And I was very early because I'd been at some kind of doctor appointment. And I'm waiting at the table looking towards the door for when she comes in so I can wave and flag her to the table. And it was blurry. So I kept taking my glasses off and looking at them and putting them on and looking at the door. And I just wasn't seeing clearly. And I told my husband, it feels like I'm like blind in my left eye, or going blind. And he goes, well, you better go to the eye doctor. Well, here it is, the end of December, New Year's, not a lot of doctors working. I was able to get in January 2nd. And the eye doctor confirmed that I had swelling and such in my eye. That doctor said there's really not a lot I can do, or anybody can do, and just follow up with your regular doctor in your regular eye doctor in a few weeks. And I don't remember if it was that doctor or a different doctor that also ordered an MRI. So I did have an MRI. This was all happening so fast that my vision was changing daily for the worse. And I made a follow-up with my doctor, and they were like, well, you can't get in for a week. I'm like, no, 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 I have to get in. I did get in, and that eye doctor didn't say there's nothing you can do. That eye doctor said, if it were my eye, I would see a retina specialist as soon as possible. Nothing we can do, or anybody can do. Yeah. It really makes me, and this is something people should take away from this. If you don't get answers, or you don't like the answers from one doctor, go to another one. Don't just take their word for it. They're a trained professional with a degree on the wall. No, speak out for yourself. And thankfully, that second doctor right away was very concerned. And he said, if it were me, I would see a retina specialist ASAP, because there wasn't anything he could do. Only a specialist could work with me. So it was within a couple of days. Again, I'm on the phone saying, no, I can't wait a week or 3 weeks or whatever it was. I need to get in now. So my husband had to drive me, and it's about a half an hour away, and dilate my eyes. And he did the test and showed me my eye on a graph on his computer with all the swelling and damage and ridges. And he said that he suggested eye injections. I believe it's a type of chemo medication. And nobody wants to hear eye injections. But when you are going blind, you're like, bring it on. Give me that injection. Start it now. And, it wasn't pleasant, but it certainly isn't the worst thing in the world. And sometimes my left eye he'd hit a blood spot, and it would be bright, bloody red. And my husband goes, oh, look like a demon in that eye.
Tell me more. So you had to first start out getting the eye injections. First of all, what do? They just do they numb it with drops first, and then they do an injection?
That's right. That's right. They put the numbing drops in. Then I think he might have done a numbing injection too before he put the medicine in. And the needles are very small, and it's not that painful. What hurt me the most was once the medicine was in there, it was stinging, and it would give me a headache and stinging.
You got the injection done every few weeks, or no?
Every few weeks. Again, this was the beginning of 2017 when that happened. Every few weeks turned into, like, from 4 weeks, let's go 6 weeks, see you in 6 weeks. Okay, let's go 8 weeks. And then every 3 months. And now I am on a yearly schedule. And I only had the eye injections about the first 2 years. And I haven't had one for a while. He's just monitoring to make sure everything's okay.
As soon as you started, you were on treatment for longer, then they were able to stop the injections?
Yes. So the injections stopped, and my vision improved from, at my lowest point, I had less than 10% vision, is what he told me. Like, if I covered my good eye, I really couldn't see anything. It went from that less than 10% vision to slowly improving to the best it's going to get, which I think is about 60 or 70% vision.
Do they say anything? They're just going to monitor it and it should stay at this level?
Right, right. I'm just on a monitor situation. And I saw a regular eye doctor recently for new glasses. And she said something that I really liked too, was protect your good eye. wear glasses when you're gardening. If something starts coming at you, that gives you a little protection. Wear sunglasses in the sun, wear a hat, protect that good eye.
Leesa, you talked about IVIG infusions and how you would continue those monthly, and they started all the way back in December of 2015. With the IVIG, at what point, who brought that up? And how did it, how did it feel? Any guidance to people on the role and the effectiveness of IVIG?
My oncologist brought it up because I started getting a lot of infections. And when I got the pneumonia, after that, he said, I want you to have IVIG. And a lot of people say it makes them feel better afterwards. I never noticed any difference in the way I felt. I know I didn't feel great for about 2 days because I think because of the pre-meds, which are Benadryl, a Benadryl drip. So you're kind of high as a kite in the hospital the day you're getting your infusion. A lot of people sleep. I couldn't really sleep, but I would just be lazy in my chair, looking at my iPad, watching some mindless TV program or something like that. But it did help lessen the frequency of infections, although I did continue to have infections here and there. What really stopped infections for me was starting ibrutinib.
What was that conversation like with your doctor? And was it like a shared decision-making process? And do you have any guidance to other people on that period of time when you're deciding, all right, is this time to go on treatment?
Well, he was ready before I was, and he had mentioned it, kind of like easing me into it. I think he definitely felt my hesitance to start any kind of treatment. And so I probably should have started it in the fall when he wanted me to, but it was definitely a shared decision. And I often wonder, would my eye issue have happened if I had started? But maybe it would have anyway. But I do think that starting the ibrutinib probably helped my eye as well.
How did your hemonc describe treatment options at that point and what this would mean in terms of, frequency and administration and side effects?
At that time, there were no clinical trials that Kaiser had, but he had told me during my watch and wait that if a clinical trial became available, that was my best option, and he would think that I should take that. But fortunately, by the time I did need treatment, my options were chemo or ibrutinib. And Kaiser does have a leukemia specialist, and my doctor made an appointment with him for me, and he discussed treatment as well. And he said, you could do either, but being you're unmutated, I would suggest you do ibrutinib because chemo doesn't work as well for unmutated. So when I had that discussion with my regular hematologist oncologist, we went for the ibrutinib, and I was just ready. I knew I had put it off far too long, and I had several months there at the end to just prepare. This is what I'm doing. It's time.
So 14 years of successful living with CLL later, what is your message to other people, and maybe in particular those who are just starting out with a chronic cancer, maybe who are overwhelmed with what is this going to mean? Can I live? Can I plan for my life? What does this all mean?
Yeah, that is absolutely the hardest part, is wrapping your mind around your diagnosis in the beginning. And I like to tell newcomers, of course you're going to feel like this, but do your best to push through as soon as you can. And don't waste one more precious day of life dwelling on the negative, and try to learn all that you can about it without dwelling on it all day long. Have fun, learn what you can, and just enjoy life.